Okay, well, hello and welcome to the HIPAA Regulations and Text Messaging webinar. My name is Beth Chase, and I will be your host for today's broadcast. Well, we have over 220 people registered for this webinar, and this really makes the broadcast one of the largest live info webinars that I've ever hosted, which tells me there's a lot of interest in the subject of HIPAA compliance. And as a risk management consultant, I'm telling you, that makes me very, very happy, because if any of you have heard me in the past at my trainings or my webinars, my message for the last year and a half has been it's a new day. And we have to be catching up with our culture, the cultural changes, and to pay attention to what's happening. So, but before we get started, there's a couple of things. First of all is that we want to have a place where you can ask questions. Asking questions is important. That's the biggest part of what we're doing here. We're going to have about 15-20 minutes of instructional time with Lorraine so she can give us some information about texting regulations, let me say this, the HIPAA regulations connected to text messaging. And when you can put these questions that you have as they come to you, as she's giving you this information, this instructional information, please feel free to type those questions into the chat box. Then another way that you can do it is for you to raise your hand. Now there is a button over here, right about here on your computer, in that little box that has a little hand there. And if you would prefer that to actually ask her this question when it's Q&A time, then I can push a button. And the theory is, and it works most of the time, then you will be able to actually speak directly to Lorraine, ask her the question, because perhaps your question is twofold, and it's something that you'd prefer to do is by raising your hand. And the last thing again is that we will be recording this so that you can have access to this training that you're getting today, and so we'll be sending you more information about that. One other thing I want to say here is that we posted the HIPAA, the comprehensive HIPAA video, and we sent you yesterday the link for you to go and view that. We had a little over 100 people who viewed it, but I want you to know that that video that is the comprehensive HIPAA training video will only be up on that website until Sunday evening at 9 o'clock Pacific Standard Time. I'm taking it down. So if you want to see the complete HIPAA training video that Lorraine has provided for pregnancy medical clinics, you need to do that between now and Sunday night, 9 o'clock Pacific Standard Time, because I'm taking it down at that point. All right. Let me push the button here. Actually, one other thing that I want to say here before I introduce officially Lorraine to you and let her take the instructional time from here is, and I know this is going to probably embarrass Lorraine, so Lorraine, you can plug your ears on this, but Lorraine Mazurek, she's a national HIPAA consultant, and she has actually, what you're going to be getting from her today, when I added up all of the training materials, the tools, the sample forms, the education that you're getting from Lorraine, in a conservative amount of money, you're getting about $1,400 worth of the professional instruction and all of the tools. And so I'm sharing this with you because I know that you want to know that, because you all give so much to the pregnancy centers. And the pregnancy centers, I know as you give so much, I want you to know that Lorraine indeed is also giving so much to you today. And so Lorraine, on behalf of the pregnancy medical clinics, all of us that are represented here, I just want to say thank you for giving so freely of your time, and we appreciate you and sharing your expertise of over 27 years in the field of medical clinic executive leadership. So I wanted to thank you for that. But before we do that, I forgot to launch my poll. So Lorraine, could you bear with me just for a moment here? And let me launch the poll so that everyone can participate. I'm going to ask you this question. Okay, where's the poll? Okay. Here's the poll. Hopefully you can all see it. And the question is, are you HIPAA compliant? You have several choices here to choose from. One is, yes, I am confident that we are HIPAA compliant. So you can say, yes, we've been working on this. I know that we are. Number two, you know, you're not yet HIPAA compliant, but you're working on it. Oh, you don't see the poll? Oh, I'm sorry. I have to push one more button that says launch it. Thankfully, my technician came in and told me that. Okay, hopefully you can all see the poll now, correct? All right. So again, please answer these questions. I'll just give you a few minutes. Appreciate that. Boy, everyone's answering. Good job, everyone. I appreciate your feedback on this. We're discovering that so many, okay, there's someone here saying that the poll is not, oh, okay, that they're not working. Okay, I see what you've done. Take a look at the poll. If you could weigh in on the poll, just push right there one of those buttons where you are at in the HIPAA compliance. Okay, it looks like everyone has voted. Just a few more coming in. Okay, thank you everyone for voting, and we greatly appreciate having that kind of insight. Lorraine, can you see the outcomes of this poll?
No.
Okay. All right. It looks like, well, 90% have voted. So let me tell you, Lorraine, 46% say that they're confident that they are compliant. 43% they are not compliant yet, but they're working on it. And 10% are saying no, but we want to be compliant. Oh, that should be TO, not OT. They want to be compliant. And 2% are saying they're just not interested. So that gives you an overall view of kind of what's coming in here, okay? All right.
Thank you.
I'm going to close the poll now. All right, Lorraine, I'm going to turn this over to you. But first, before I do that, I want to introduce Lorraine to you. Lorraine has become a highly respected part of the pregnancy medical clinic movement. And over the last year and a half, she was vital to what we were able to do here in the Pacific Northwest in stopping some legislation against the pregnancy centers both in Washington State as well as Oregon. But Lorraine has over 27 years experience in upper level management running medical facilities. She's a nationally recognized HIPAA trainer and currently assists the pregnancy medical clinics to become accredited with the Accreditation Association for Ambulatory Healthcare, which is a whole nother webinar that we provide from time to time about accreditation. So Lorraine, at this point, I'm going to turn it over to you.
Thank you, Beth, and welcome everyone. Thank you for all those that came on early and got to listen to about the HITECH Act. And so I'm going to start this right here. I think you're going to need to get rid of the button bar.
Mm-hmm. Okay.
There we go.
There we go.
Okay.
All right.
Okay. Did you hand it over to me?
Uh-huh. Sorry, everyone. It takes, this is live webinar.
Okay. So how seriously does HIPAA take the issue of text messaging? Did we miss a screen? Let's see. No. Wow, we missed a lot of screens.
Well, hey, hold on, Lorraine. Let me get back to where you're supposed to be, okay?
Yep.
See, right after you, then there comes this one.
Okay. So we were at the right screen. Sorry about that, everyone. Anyway, how seriously does HIPAA take this issue of text messaging and private health information, and why? Biggest reason is privacy of protected health information or private health information. HIPAA has two divisions. One is security and one is privacy. And text messaging, because it's done electronically, falls under the security part, and it also falls under the privacy part. So there are rules and regulations that govern how that happens. And so you have received a lot of information, sample policies and consent forms, and all of that information is compliant with HIPAA. So Beth, you need to move the button bar on the bottom so I can move it.
Okay, you can't see it. Okay. Someone just reported that they had lost the audio portion, and I'm thinking it's more their particular situation. Could everyone just type in if they're getting the audio? Please say yes in the box. Okay. All right. It's working. All right.
So I want to just highlight a couple of things on the policies that you had as a download. And so the first one is the communicating protected health information via electronic mail. And if you would go, if you have it in front of you, to page 2, I've highlighted 3 areas. And because text messaging cannot be done between telephone and telephone, it needs to be done via email that shows up as a text on the patient's phone. You need to have a disclaimer that you would have on your email address, and you will put, what you could do is you can put it into your signature block of your signature, where it just says this electronic message is intended to be for the use of the name recipient, and on and on. I don't want to go into big detail because I want to be able to answer a lot of your questions. So that is mandatory to have on there. So when you're setting up your text message email account, and we'll go into that a little bit later, you'll have that in your signature block. The other things are users who communicate private health information via email will comply with all other policies and procedures, but not limited to the confidentiality policy and the minimum necessary policy. And if you have gone through the comprehensive HIPAA training, the minimum necessary is you just give the information that they're asking. You don't give anything in addition. You just give them what they're asking.
Lorraine, okay.
The other one is you can reserve the right to deny a patient's request to communicate with you via text messaging or email.
Lorraine, can I interrupt just for a second? Can you show me what? Okay, I have moved to these forms now because I think that they need to see it. Which form are you on now?
On the first one.
Okay, which is, what's the name of it?
It is called communicating protected health information via electronic mail.
All right. Okay. All right, everyone. I have this up.
And I'm on the second page.
Okay. Hold on. Second page. Okay. You all should have a copy of this, but we wanted to show you the specifics here. Okay. Go ahead.
I'm on the third highlight. You want to?
Okay. Right here. Oh, third highlight. Okay. There we go. Third highlight. All right.
So basically what it says is if someone fills out on their request for services or however you're asking them how they want to be communicated with via email or text, you can deny that request because you have the right to do that. And so but on the other hand, you need to know that you need to let them know that in writing. You can't tell them verbally. You need to let them know that in writing. And so that's part of the comprehensive HIPAA training, and so you may want to, when you download that, you can read that. Now on the second one, the text message email communication, that's the second page policy.
This one?
Policy.
Okay, it's this one, right?
Nope, that's the consent form. That's the last.
Oh, sorry. Okay. Guidelines?
Nope.
This one.
That one.
Okay. All right.
Okay. One of the things that I highlighted is the use of text messaging and emailing is not a secure communication vehicle. That's why you have them sign the consent form, because it explains to them that even though you're going to do what's reasonably under HIPAA guidelines to secure their information, that there is a chance that it could get hacked with all the changes in data there's not a 100% foolproof hack-free system. And so by putting that on the consent form and having them sign it, that is minimizing your risk. So if there ever was a breach, you have shown that you've communicated that to them, and and they have signed that. Mm-hmm. The next one is the guidelines. And this one I highlighted, establishes types of transactions. So in your policies, you need to be able to determine, based on what your board and your medical director and you as management decide, what you want to disclose in those text messages. If you just want to remind them of their appointments, then that needs to be in your policy. If you're going to say, we're going to remind you of your appointment, but then if you've had STD testing, we're going to let you know that you have a negative result, you can put, test results in there. Whatever you do is what you need to have in your policies. Don't have anything in your policies that you don't do. And the reason for that is that if you were ever had a legal battle, the first thing that a lawyer is going to ask for is your policies. And by having whatever's in those policies, you better be doing. And so if you're not doing something, but it's in your policies, take it out. So this would probably be a really good time to look at all of your clinical records and health information policies to make sure that whatever you're doing, you have in your policies, and if there's something in your policies that you're not doing, then take it out, because that's the first thing a lawyer will look at is your policies and say, well, this was your policy, so it's just a good time to clean up your policies.
Lorraine?
And then the last one is the consent form.
Okay, Lorraine, I have a question here about the consent form that was brought up, and they want to know if does this consent form need to be separate, or can it be added to a present consent form?
It needs to be separate.
Okay. Oh, where's the consent form? That's not
Well,
it.
this is just policy on the consent form, and basically what it's saying is that if you have a patient that comes in, whether it be existing or new, that they are going, if they want to be communicated by text or email, they need to complete the consent form. And before you can initiate that text messaging or email, they need to a test needs to be done, and it needs to pass. And so the test, and you'll see it on there, I think we said, what city were you born? So you would take that number, you would, email, which shows up to them as a text, and it would say what city you were born. They respond, they've passed that test, that goes into their medical record, and so now you know that you can email and text message.
Lorraine, could you tell us why this consent form needs to be a separate form than from adding it to what they currently have?
I don't know what they currently have. So if you're talking about the notice of privacy practices, those are entirely different. The notice of privacy practices acknowledgement is acknowledging that they've read or obtained a copy of your notice of privacy notice. Text messaging is separate from that. And so a notice of privacy practices is telling them how you will disclose information, whether it be for treatment, payment, healthcare operations. Text messaging is separate from that. Now, if they want to send me a copy of what they want to do, I can let them know if it's okay.
Wow, that's very generous. Okay.
Okay?
All right.
All right. So if you can move the button bar, Beth.
Okay, do I go back to the PowerPoint? Are you ready for that?
I am.
Okay, then I'm going to go back to the PowerPoint, and we will get on the correct PowerPoint.
Which is the forms.
which is the forms right here, correct? Okay, from current slide. There we go. All right.
Okay. Yay! Okay, so the forms that you were able to download was the patient request for email text communication consent form. And that is a 2-page form, and basically saying, you know, be aware of what you can communicate, keep your conversations confidential. That also speaks to the policy of minimum necessary, meaning if they ask a question, you just answer the question, you don't expand on it, don't give them any unnecessary information. It also is the consent, saying, yes, I want to be able to be communicated via email or text. They're giving you the service provider because you've also received a copy of all the service provider email addresses, and so you'll need to have that. And then there's also the test questions. The next one is the steps using Google for free text messaging. It's how to set up a Google account. And I wanted to mention that if you already have an organization email account, but it's not through Hotmail or Yahoo, but you have something like, for instance, the Pregnancy Alternative Center has, you know, the name at pregnancyalternativecenter.org. You can set up an account just for text messaging. It could be receptionist at, you know, .org or whatever. It doesn't have to be Google, but if you don't have a email account set up that's not with Yahoo or whatever, you would need to set up this Google account. I hope I'm being clear on that. This is telling you how to do that, and basically you're just going to go in and set up an account. You're going to, you know, determine what that name is going to be, and then that account is just used for the sole purpose of communicating to patients via email or text. And then after one of the key points is if you're communicating anything medical information, that would need to be printed, signed, and put into the patient's medical record. And the next one is, let's see, where is that? There we go, the risk assessment. Oh, hold on. You were given a, I don't know.
Lorraine, let me get you back on because it's, hold on, I'll get you there. There we go. We're on the risk assessment.
Risk assessment is, I believe it's 11 pages, and this is something that even though I know you polled and said that, you know, we're very HIPAA compliant or you're almost there, the way that you're going to know whether you really are or not is by doing this risk assessment. And it's mandatory for the HITECH Act. So by doing this risk assessment, you can determine all the required things you would need to have in place. Again, the addressable issues you would need to look at, determine whether it's financially feasible, if it fits within your model of how you do things in your centers, and then if you decide not to do those, then you need to document why. And then this needs to go into, be presented to your board to let them know that you've done this. This is where we're at risk. This is what we need to change, and it needs to be reflected in written documentation, whether via meeting minutes or just having the risk assessment, you know, in your HIPAA manual. I'm having a hard time seeing these arrows. There we go. Okay, so the 4 basic rules are always use an email system to text your patients. You never want to do it phone to phone. You add the recommended disclaimer to the signature line of your email, and that's in the Google email information. It's also in your policy. Always print out and sign and file copy of a text message if there is medical information included. There we go. 6 steps to process for new client phone calls. So you get a phone call in, and they're saying, I want to set up an appointment for a pregnancy test, and so you'd ask the potential patient how they want to be reminded of the appointment. If they say, you know, phone call, whatever that is, you're going to secure a verbal permission on the phone. You're going to obtain their cell phone number and or email address if they decide that that's how they want to be communicated to. You're going to note it in a phone log, and then you're going to use the Google or your organization's email provider, ensuring disclaimer is included below the signature line. So that would be in your signature block. And then you would copy the message, you would sign it and file it if the communication includes protected health information. For that person that comes in for an appointment, so they've come in for their appointment, you're going to, and they request to be communicated via text or email, you're going to have them sign a consent. A designated person will perform a test to ensure the information provided is accurate using Google or your organization's email system. If the, oops, my computer.
Here, Lorraine, let me get you back on track. Uh-oh.
That's why it keeps going forward. Anyway.
Yeah, okay, let me get you back. Okay.
Okay, a designated person will perform a test to ensure, we've talked about that. There we go. If a test is successful, the consent form will be signed by the organization's representative and filed in the patient's medical record, or if you're using electronic health record, you'll scan it and place it in the patient's electronic health record. If the test is unsuccessful, no texting or emails can be performed. And unsuccessful could be that it's kicked back to you saying undeliverable, or you don't get a response from the patient. And so you've emailed them the test question. And so this is a really good learning tool for the receptionist when they're going over the forms with the front office, with the patient, saying, we need for you to fill out this information, request for services, and whatever information you have those patients sign when they come in. It would be a good idea for you to train your receptionist to say, if you want us to communicate with you via text or email, we need for you to fill out this consent form, and there's a test question which we are going to ask you. It's really important that you respond to us, or else we cannot communicate with you via that mode. Because, of the clientele that we all have, there's a lot of times they don't answer. So just reiterating that at the front office and then possibly at the end of the visit would be a really good way to remind them. All communication that contains private health information will be printed, signed, and placed in the patient's medical record or scanned and placed in the patient's electronic record. So the question is always, what is considered private health information? Well, I got this right from the Health and Human Services, and it is demographic information, medical history, test and laboratory results, insurance information, and any other data that is collected by the healthcare professional to identify an individual and determine appropriate care. So all of that information, if you're putting any of that into an email or text, that's considered private health information. And so now we are ready for questions. I know that was brief, but we wanted to spend a lot more time answering questions. You have all the materials, and so we'll answer questions as long as we can today. And then, of course, if you have additional questions, you can email Beth, or you can email me, and I'd be happy to answer them for you.
Okay, and
Beth?
Okay, a lot of questions have come in. That's good. If there's any of you who want to raise your hand, I can call on you, and you can ask your question directly to Lorraine. Now, just a reminder here, I think we need to make clear, and I think you all saw this, is that this is basically an info webinar. This is not a course. And I can, judging from all of the questions, there's almost a need here, Lorraine, for this to be put into a course format, which will take everyone through the detail of this step by step. Again, this was just an overview. It's an info webinar, help you to understand some of these components that you need to be aware of. And I know it's a lot of information, and it's a new way of thinking, too. Okay, so I'm going to start at the top. There's a lot of questions about whether or not they're going to get this printed PowerPoint presentation, and yes, you are. You will be receiving from me sometime today after the recording goes through its processes an email from me that will have a link to where you can listen to this recording again. Number 2, a link to where you can download these materials. Number 3, it will also include these PowerPoints in a PDF format, so you can click through and take a look at them again. I will also include in a PowerPoint or in a PDF format where it will have a slide at the top of one page with a place for you to take notes. So for instance, maybe you want to have your entire team listen to this presentation. Well, you can do that by using that particular document. So a lot of questions about that. A lot of questions also again about the risk management or the risk assessment, where they can find that. Again, the risk assessment, in fact, if you guys will just bear with me for a moment, because there's so many questions for that. Let me show you here. If you will go to, let me get on here and open up another thing. There we go. If you'll go to bethchaseblog.com, and I've already sent you all this link in 2 emails that I sent out yesterday and day before, and you go right here to the HIPAA text messaging telecast. You will find here all of the forms that Lorraine has just gone through. So please, you can go, and if you notice here, here's the Business Associate Agreement. You can download that, and you can download the risk management. All right, so let me now get out of my, well, yeah, I'm going to go ahead and get out of that now. I have a lot of boxes here that are open. Okay. All right, now let's take a look at these other questions. Hold on, from current slide. Okay. All right, more questions. General inquiry about if you have sample policies and procedures about how our center can be HIPAA compliant, not only with text messaging, but emailing clients or other nurses as well. Also, as you are discussing currently, the electronic transfer of ultrasounds, which is what our center does. Thank you. So I think what they're asking for is if you could maybe talk a little bit more about what constitutes electronic transfer of information. Just circle back and summarize that again, if you would, please.
Electronic transmission of electronic health information would be texting or emailing your patients with regard to what was the definition of private health information, which was demographic information, medical history, lab results, those types of things. So if you were to email your patient and it shows up as a text or an email to that patient and you're saying, you know, your STD results were negative, or you know, the ultrasound had changes to it after the physician read it, that would be considered protected health information. When you're transmitting the ultrasound report and pictures to your medical director or physician that you have that is reading them, that is protected health information, and so that needs to be done securely and that also needs to have an electronic signature. So all of those modes are considered electronic health records. If you have, if you're using electronic health records like Practice Fusion or any other, Centricity, NextTech, and you are receiving lab results from the lab directly into that record, that is electronic health information. Anything that falls under the definition of protected health information that is through a computer, through the internet or intranet, is considered electronic health information.
Wow. Okay. Susan has raised her hand, so for fun, something different. Okay, Susan, I hope you're there because I am going to unmute you. So Susan, you are now unmuted and you can ask your question. Hello? Susan, are you there? Okay. No, Susan. All right. Well, we'll go back here to some of the written questions. All right. All right. Does this need? Okay, we talked about the need for this consent form to be a separate form. Could you just restate that again, because there's still questions coming up about why that needs to be a separate form. So if you would please restate again your offer and the summary on that information.
Well, first of all, I would need to know what they're wanting to add it to. And if they're adding it to the Notice of Privacy Practices acknowledgement, then that's the Notice of Privacy Practices acknowledgement is acknowledging your Notice of Privacy Practices notice, which you are to give to your patient or have them read prior to being seen in your center. And so, and that describes how you're going to disclose your information via treatment, payment, or healthcare operations, and that really doesn't have anything to do with email or texting. And so that's why you would need to have it separate. You would need to have that test question on there. You would need to test it. It needs to go in their private, into their medical record. However, if you have another reason why you want to add it to another document, I need to see what you're wanting to do and where you want to put it for me to be able to say, yes, that would be okay, or not, no, it would not be okay. So again, if you want to send it to me, I would be happy to take a look at it and let you know whether it's okay or not.
Lorraine, where does this consent form go? Into what file?
It goes into the medical record on the, and again, it's the left-hand side. I don't know if everyone, is doing their medical records the same, but normally what would happen is on the left-hand side of the record, you would have on the bottom the person's ID, copy of their ID. Then you would have the Notice of Privacy Practices, and then you would have the email consent on top of that. And then you would have the request for services, or again, I don't know what forms you're using, but that's how it would go normally.
Okay. A question is, of course, where they can get a sample of this text consent form. That, again, if you'll go back to bethchaseblog.com, go to the HIPAA webinar page, it's included in those downloads. Here's another question. It says here, oftentimes texts are initiated by potential clients and that they use the Google Voice for their text line. Is it implied consent on their part?
If they haven't become a patient yet, they're giving verbal consent for you to be able to do that, which is fine. But when they do come into the center and they are an established patient at that point, then you have to get a consent signed for ongoing communication.
Okay, I think an important way to organize this in y'all's mind is that there is, like Lorraine went over this in her PowerPoint, if a client calls you, she's not a patient yet, she's handled differently than when she comes in and now she's a patient. Those are two entirely different tracks. You will find a chart that lays out those two tracks on the Beth Chase blog page for the webinar. So it's included in that packet. All right, so here's another question. I think it's, well, it is written by the same person, connected to this question. She says here, we do not answer medical questions, typically encourage them to call or ask if we call them on their number. So one question I think that comes out of this, Lorraine, is if someone who's not a patient yet initiates medical questions, is that allowable?
You don't want to answer medical information without having a history of the patient, because you may be giving them information that doesn't fall within what their health history is. And if without knowing that, you're at risk for telling them something that may be in complete opposite of what they need to be doing based on their health history. And then if something was to happen, they could come back and say, well, XYZ pregnancy center told me I can do this. And so you don't give out any medical information or answer any medical questions until you have, you know, a nurse or a nurse practitioner or a physician review that person's medical history and be able to know, what's going on with them.
Okay. Thank you, Lorraine. Okay, Wanda has her hand raised. So Wanda, I hope you're there. I just unmuted you. Are you there, Wanda? No, not there. Okay. Well, you need to either, you have to have audio capabilities, or I'm sorry, mic capabilities. If you're going to be raising your hands, you either need to be on the telephone that way or be able to have a computer for whom you can, with a mic to it, and you can ask questions. So Wanda would love to get your question answered, but perhaps type it in. All right, here's another question. Someone says here that they've added a line of consent to the request for services, and this is something that I see a lot, is that they just add a simple line that says, do you give us permission to text you? And they think that that's enough, or they think that that's HIPAA compliant. Could you particularly address that?
It isn't, because it needs to be an informed consent. And so just by having someone say yes, you're not disclosing to them the risks. So that's where an informed consent comes in. Therefore, you have a 2-page document. And I know there's a lot of paperwork, and patients get sick and tired of filling out paperwork, but it's protecting you, and so you need to give them a informed consent to let them know that there are risks in emailing or texting them information, and they are consenting to that, knowing and being informed on that risk. So just having a line on a request for services is not an informed risk, informed consent.
Okay, here's another question. How important is the test that takes time and resources to test every time, it looks like, or every patient maybe? So how important is the test process prior to starting to send out text messages to a patient?
Well, it's important, and I know that especially with one of the centers in particular that I know that are doing it and are having a hard time with it, is they either don't get an answer back, and so therefore they can't communicate with them via that mode. But you need to make sure that you are communicating with that number that person's given you, and that's actually the person. And so that's where that informed consent comes in and says, we are, and that's where the receptionist comes in saying, there's a question on here that says, what city were you born? It's important that you know that when you get that question emailed from us to you or text to you, that you answer it so we can communicate that way. It's all about education to the patient. And again, going back, it is very important because you don't want, they may have given you the wrong number, they may have given you someone else's number, and you don't want to be communicating information to someone that you don't know. So you need to make sure that you are emailing to the right person.
And Lorraine, this just has to be done initially. It doesn't need to be done prior to each data transmission, correct?
Initially, yep.
Okay, so it's an initial test that should be done. Now that test, when it's done, is that done right away? Meaning like the patient is there, they've signed the consent form, and they're sitting there with the patient. Should they test at that point to make sure that it's working?
They can do it at that point. They can do it you know, during the patient's visit. They can do it after the patient leaves, whatever is the best flow for the center, and, you know, and personnel and, you know, having someone designated to that. You know, if the receptionist is not busy, which, you know, normally is not the case, but if that person has the time, then I would do it right away. If they're busy and it's designated to someone else, then whatever flow works best for the center.
Okay, now here's a question about the confidentiality issue of using other devices other than the computer, if they are secure enough. I have two questions. One is the iPad secure enough, or is the iPhone secure enough, or do they always have to use a computer so that the text message is coming from the computer?
Well, an iPad is considered like a little computer, I would think, and you would be going through email. If I'm understanding how iPads work correctly, it would be you're logging into your email on your iPad, and then you're texting them from the iPad. The iPhone, if you're logging in to your email off of your phone, like I can do on my phone, I can get into my secure email, on my phone, then yes, you can do it off of that as long as it's through an email, not texting, phone to phone. Mm-hmm. Does that make sense?
Yes. I have an iPad. I also have an iPhone. My iPad has the ability to send text messages.
Oh,
now,
okay.
Both the iPhone and the iPad, though, their platform is a little bit different in that it's considered instant messaging rather than text messaging. So, because they've made those changes because they're trying to get out ahead of some federal rulings that they see are coming down the pipeline. So what I hear you saying then is whether you use your smartphone, whether it's a Droid or an iPhone or your iPad or one of the notebooks. That's
right. You need to log into your email.
Always go through your email to do that. Okay. Let me look here. If we are only texting appointment reminders, then we don't need to print that out and put it in the client file, correct? That's the question.
Correct. As long as there's no identifying information, meaning you're not telling the person, the name, their first name and last name. Remember, demographic information is considered protected health information. So as long as you're not, saying, Lorraine Mazurek in Brownsville, Oregon, you have an appointment, with us tomorrow, that type of thing, then that would be considered private health information. But if you're not saying that and you're just saying, we're reminding you of your, appointment for your ultrasound tomorrow, that's fine.
Okay. Now, Lorraine, you and I were talking about this the other day and how one of the key elements of that is if you're going to text, now correct me if I'm wrong, but what I thought we had talked about was if you're going to text an appointment for a medical procedure, whether it's an ultrasound or a pregnancy test, and if you include in there the name of the organization, such as, you have an appointment with Life Choices Pregnancy Medical Clinic at 1 o'clock on Thursday. Now that becomes something that is a PHI, correct?
Correct.
All right. So the other side, what Lorraine is saying is if you want to send a text out reminding someone of an appointment, but you don't tell them who you are, then it's not a PHI. And personally, she and I were laughing about this. Personally, I would, I get some of these texts from some of my medical professionals, but they always tell me who they are. So if I get a text message from my dentist who says, oh, by the way, remember your appointment at 2 o'clock on Thursday, I would think, well, who are you?
Right. It's not best practice, for
right.
sure. Yeah.
Okay, now what about those, and here's some questions here, the difference between these rules and how they apply to the relationship that they have with the Earn While You Learn clients. Could you talk about the distinctives between the patient and the Earn While You Learn clients?
Well, and that's really interesting because after, since Monday I've been reading and HIPAA. And so when I didn't realize, which I should have, but I didn't realize that demographic information was considered protected health information. And so of course that in my head went, oh, so this may even pertain to Earn While You Learn or, parenting classes and all those types of things if you're putting any type of demographic information into those messages. So I guess what the point I'm making is as long as you're not including any of those things that are on that list, the private health information. Can we go back to that one,
Sure.
Beth?
Yes, hold on. Let me get there. Back. Oh, went too far.
So,
okay, there we go. All right.
As long as you're not saying anything, demographic information, medical history, any of these things that are on the list, and this is the only things that were on the list from the Health and Human Services, then you're okay to be, texting your Earn While You Learn people. But if there's anything on that would suggest any of this information, then it's considered protected health information, and then that would need to be printed off and put in the patient or the client's Earn While You Learn folder.
Mm-hmm. Lorraine, could you give us an example of what demographic information would be?
It would be name, address, phone number, date of birth. That's demographic, their address, cell phone, email address, anything that could identify that person.
Okay. Another question. What if you want clients to be able to text for initial contact and scheduling of appointments? How do you get the consent done? Okay,
if they're a new patient, verbal consent. If you have never seen them before, then a verbal consent is fine until they come into the center.
All right. What if you had to advertise your text line and the client initially contacts you via text? If you then send a disclaimer, are you covered?
I don't know. Are they brand new patients?
Yeah, it sounds like it. Yeah.
And it would just be the verbal consent. And again, you're not texting from your phone. You're texting through the email system that shows up to them as a text. And so you can communicate to that person because you're getting a verbal consent. After they are an established patient, then you need to get a written consent.
Okay.
And the reason for that, you don't have any protected health information yet because they haven't even come into your center. Does that make sense?
Right. Right.
There's nothing to protect.
Okay. Lorraine, the copies that you went over that you highlighted, are they different than the copies that you gave me that I have posted on the page?
There shouldn't be.
Okay, because a couple people have said that there's they're missing a paragraph that you had highlighted on their particular document. So, okay.
I don't know.
Yeah, I don't know either, but so to give everyone peace of mind, we will make sure that all of these documents are as they should be. Just give us the remainder of the day, and by this evening we should, I'll make those changes just for everyone's peace of mind. It says here, we have a very high population of Hispanic clients. Are these forms available in Spanish?
So I have, what I have in Spanish, and actually what you can do, I have some forms in Spanish, but if you have Windows 7, you can go up to review. When you pull up the document and you go to review, and on review there's a place where it says translate, and so you highlight the whole page and hit translate, and it'll come up and it'll go to the like a website, and it'll ask you what language you want it in, and you hit that and it will translate it. The only bad part about that is that because our English language can be different, translated differently into other languages, you would need to have someone that actually knows how to read that particular language to make sure that the context is correct, because it skews some of the words. That's how I do it.
Okay. All right. Question here is, would you address having a client text in response to a Google number you have posted regarding making appointments? I'm not really sure what that means. Do you know what that means, Lorraine?
No.
Okay. All right.
I don't know what that means.
All right. If the person who wrote that, if you want to raise your hand and make sure you're on a telephone or you have a mic, let's see if we can't get that question answered for you. Okay. If you text a client to remind them of an appointment or class, do you have to print and file that?
Not if there is no protected health information in it.
All right. This is a fax question. We no longer fax, but we've received faxes from a few doctors with private medical information about the client. Should we stop them?
No. There in the comprehensive HIPAA training, there's a whole fax policy in there. And basically what you're doing, if you receive information from your patient's physician, then you're going to have it reviewed by the nurse or the nurse practitioner or the physician. They're going to sign that they received it. You're going to log it into your medical or clinical record and health information log, and then it's going to go into the patient's medical record.
Okay. All right. Now here's someone, they said, I just sent a test text. Wow, say that 2 times. Test text to my phone, the legal disclosure, quote, the email is intended is cut off. Therefore, the patient will not receive or see the full disclosure. I don't know if she used a computer or not. I guess that would be the question, correct?
Right, and it should show up. So when you're emailing and you have the disclosure on the bottom and shows up as a text on your phone, then you should be able to see it. I don't know why that would be.
Okay.
I don't know the answer to that.
Okay. Well, okay. Well, that person who wrote that might want to give you a call. Here's another question. My cell phone is on our answering machine for after hours. What do I do when someone texts me directly? Can I text back from my phone if they initiate it? Well, that's the same kind of question. Go ahead.
So if you have a smartphone, then it would behoove you to sign into the email that you have, or if you have an iPad or whatever you use, notebook, sign into the email, use that email account. And so that's why you know, I have like 5 different emails that I have downloaded on my phone, so I can answer, you know, so no, you can't do it phone to phone.
Mm-hmm. Okay. Where do we find the new patient flow through that is shown for a receptionist to go through? Okay, that flow through is in a chart format, and that is included on that page that I showed you on the Beth Chase blog page. It's there. In addition to my previous comment about transmitting ultrasound, our physician is able to access our server from home to sign the ultrasound reports. So is this more secure and not technically considered an electronic transfer of information?
If he's signing into your account from his home, he needs to sign, number 1, a confidentiality agreement. Number 2, he needs to make sure that his computer is in a place where family members can't walk by and see what he's doing, friends or anything like that, to where, you know, he walks away from his computer and there's, you know, Lorraine Mazurek's ultrasound report sitting there, and his, you know, wife or children or, you know, grandchildren, whatever, walk by it and can see that. That would be my concern. And if he's logging into your account, then no, he would not. It would not be considered a transmission of information. My only concern would be how he's securing it at his house. Is it in an office? You know, when he walks away, does he log off? You know, can people just walk in and see what's up on the screen? That would be my concern.
Mm-hmm. And I think Lorraine raises a good point here, that by using the risk assessment, these are the kind of questions that the risk assessment causes you to ask based upon your particular situation, right, Lorraine?
Right.
So that risk assessment is really important. Now, here's something that I was wondering about this as well, that, you know, we're all taught with the ultrasound reports, you know, to not put any identifying information specifically about a client. So they use numbers and not her name and that kind of thing. Does that decrease any of the HIPAA requirements by doing that?
By putting like a patient ID number on it?
Correct, and not having anything that personally identifies them.
Yeah, a patient ID number would be fine, because then it can't be tied back to anybody.
Mm-hmm. But then does that mean they don't have to be HIPAA compliant, or that it doesn't qualify as an electronic transfer?
You're still transmitting electronic health information. The key to that is, if anyone was to see it, could it identify it back to a person? So that's what you have to ask yourself, is, you know, each form should be, each medical form should be having a date of birth. Mm-hmm. If you want to use a patient ID, to me, based on HIPAA being, you know, reasonable, if I was to see it, I would not be able to know who that person is by their date of birth and patient ID number. So I would say that it's probably not identifiable. So no, it wouldn't be.
Okay. This question is, I work with ongoing adoption clients, and sometimes texting is used regarding counseling issues. As long as we have a client sign a consent, are we okay? And we use an established Google email and transmit to the client's phone?
Yes, as long as it's not phone to phone.
Okay.
As long as you're going through an email account.
Mm-hmm. Okay. Do you have a sample HIPAA complaint? No. A sample HIPAA compliant medical file. Oh, I know what she's asking. Okay. She's asking, you know, you had mentioned the medical file and how that medical file should be structured according to, okay. You want to talk about that?
Yeah, you know, and again, it's based on what forms you're using. But yes, there is a standard of what should be in a medical record, how it should be constructed, reverse chronological order, that type of thing. Yes, there's actually a PowerPoint that I did, remember, Beth, on the forms, medical record documentation, and then the actual construction of a medical record. So, we can make that available.
Okay, so that's that form we worked on last week that just has, it's a two-pager. It shows what goes on what side of the form and what documents go into the complete file.
And then I also had done a PowerPoint,
okay,
a while ago, talking about medical record documentation, and we were going to do a webinar on it, remember?
Yep. Okay.
Yeah.
Yeah, I think that's pretty important because the more I understand the standards that's expected in doctors' offices, this is basically the standard that's required there. So we'll get back to you all about that and see if we can't get that available to you quickly. They had a kid ask, can dry sperm get a girl pregnant? This was interesting because it was a boy. Is that considered PHI?
What now?
I guess they had a text message that was asking about a health medical condition. The question was, can a girl get pregnant from dry sperm? I don't know what that means.
I wouldn't even answer that.
Okay, so those are the kind of questions you just say you need to come in and talk to our nurse. That's a good example of where you don't want to go in text messaging.
No.
Is information like abortion pill questions considered medical information?
Is questions about abortion?
About the abortion pill?
Oh, abortion pill? Well, again, it could be a slippery slope. If the patient is established, then yes, you're giving them medical information. If the patient isn't an established patient, do you really want to be giving that information out to a person that you really don't know who's on the other end of that phone? And you don't know what their medical history is and that type of thing. And so I've always kind of defaulted to not giving out any medical information until, that person's established and you have some kind of baseline of where they're at, physically.
Mm-hmm. Yeah, I think that's a pretty safe thing. And then, even at that, it might be good to have each one of those answers thought out, or questions thought out ahead of time, approved by the medical director. So there's, things are not being said that you could be liable for.
Right.
All right. Here's another. Go ahead.
It's really, you're at risk giving any type of medical information or advice or anything to someone that you don't know. I mean, I would default to never be doing that.
Again, there's a couple of questions as far as how to access the HIPAA compliant video that Lorraine has published. I will send out in this email the link for that. If you all don't get an email from me by tomorrow morning, check your spam, because I'm finding that some people are not getting what I send out. I don't know why, but so it will be going out today. If you don't get it by tomorrow morning, check your spam file for some reason, or give me a call and we'll figure out some other way to get the job done for you. Another question, for non-patient contact via online chatting, is there any compliance needed here?
Online chatting?
Mm-hmm.
What are you chatting about? That would be the key question that I would ask.
Mm-hmm. I guess.
And so I really can't answer that until I would know that.
Mm-hmm. Well,
and are they an established patient? What are the questions? What are you chatting about?
Mm-hmm. Well, I think what's happening here, Lorraine, is that some of the webmasters for the client websites are putting on the front page the ability for them to have an instant chat.
Right.
And I'm discovering that that's becoming quite popular, and I understand that because it's the world of our target audience, and I think it's a great idea. But I think what she's asking for, what are the boundaries? And to me, it sounds like the boundaries are the same. You can't, your main goal, just like you're talking to them on the phone, your main goal is to get them to come in and be a patient, because you have limitations until they're a patient. You have limitations.
Exactly. I would not be giving any medical advice or any medical information in that mode. I would just simply say, you know, we would love to be able to answer all of your questions and more. And so please, you know, schedule an appointment and come in and see our, you know, healthcare professional.
Mm-hmm. Okay, could you share one more time, because I've had two questions here kind of towards the end, why they cannot text via phone?
Because a CMS or any texting is not secure at all. You know, the phone gets lost. You know, it's been considered that, you know, texting from phone to phone is not a secure mode, and there's no way to be able to print things off from it. There's no way to archive those types of transmissions. It's just not allowed.
Okay. Would it be okay to give the client a PIN number instead of asking a question for the privacy test?
Sure. You can ask whatever question you want.
Okay.
I just used that as an example. Actually, the original consent had 3 questions that HIPAA was saying, you know, you should do, and I thought that was overkill, and so that's why I just put 1, but you can ask any question.
Okay, does the test have to be repeated if the phone number changes for the PT?
For the patient, yes.
Uh-huh. Okay, how does this webinar apply to non-PHI text messaging? Example, date and time of appointment or confirmation of appointment.
It wouldn't, if you're not disclosing any of the private health information, which is demographic information, then it would not apply.
Or if they mention the name of the pregnancy center as the location. Okay. Can volunteers be utilized to answer text messages from client and/or patients?
That is entirely up to your organization. You know, they would need to have parameters. They would need to go through the email system. They would need to know what they're allowed to say and what they're not allowed to say, even if they're healthcare professionals. You know, I know that the pregnancy centers utilize volunteers a lot, and you know, and it's harder to hold volunteers accountable than paid staff, and so it would be my suggestion that you have clear guidelines for that person of what they can say and what they cannot say.
Mm-hmm. Oh, I so agree with that. That is so important, and it's so hard for us to wrap our heads around. Yeah,
right.
And now understand, everybody, that we're coming from a serious core value that you're a medical clinic.
Right.
And therefore you need to act like a medical clinic. And I know there's a lot of confusion out there about who you are. I find that a lot of affiliates are confused. So just so you know, we're coming from the assumption that you're a medical clinic and therefore must conduct yourself as such. Here's a question. Do you have a sample phone log?
I don't really do anything with phone logs. That's your thing, Beth.
Okay, yeah, Well, I have the one that you approved, so I will add that to the list this afternoon, and so it will be there on that bethchaseblog.com page. How does the Google Voice app work? Is that HIPAA compliant?
I don't know anything about Google Voice.
Okay, I don't either.
And so I will have to ask my IT person what Google Voice is. I wrote it down.
Okay. All right. Okay, this is a question. If we only use texting for appointment reminders and never communicate PHI through texting, do we have to be HIPAA compliant?
Yes. Because it's not just the texting part of HIPAA compliance. HIPAA is all about privacy and security of protected health information. If you have patients and you are doing pregnancy tests, if you're doing ultrasounds, STD testing, prenatal care, OB care, whatever you're doing that is medical, you fall under HIPAA because it's considered private health information. Now, of course, they're redefining what a covered entity is, and they talk about electronic transmission. But if you look at the risk assessment, it clearly states, do you have a secure place for your medical records? Do you have a secure, do you have passwords for, your people that, have access to that, like your front desk person? Do you have policies in place that will, when someone walks away from their computer screen, that has the appointments with people's names, that they log off? There's a lot of, there's administrative safeguards, which would be all your policies and procedures. There's the physical safeguards, which means confidentiality. Are you, being quiet when you're walking in halls and talking about patients? And then there's the technical safeguards, which talks about, are your, computers secure? Is your, computer server or your system secure? And so those three components are HIPAA. And so if you're a medical clinic, then you need to be HIPAA compliant.
Mm-hmm. Okay, I think we're getting it. You need to be HIPAA compliant. Here's the question. If we copy and paste text messages into the client file in the computer, do we also need a hard copy?
So if you don't have a hard, so you're saying that you have part of your information in one system and then you have a paper chart, I'm assuming is what you're saying?
Well, I don't know. I think what they're saying here is that they copy and paste the text messages into a client file that they have on the computer. So they must have a client file on the computer, and she's asking then if they also have to make a hard copy of it.
Oh, no. Nope.
Okay.
But if they have a hard copy file, then yes. Does that make sense?
Uh-huh.
If they're only electronic, then they just need to be electronic.
Okay.
If they're doing both systems, then it needs to be in the other system as well.
Okay. Okay, here's a really hot question. I get this a lot. It's going to open a Pandora's box and people aren't going to like it, so hold on, everybody. If a peer counselor who's non-medical collects health information, is that part of a PHI?
Yes.
Should they be collecting health information?
A peer counselor or a patient advocate or that type of thing. The patient advocate notes that we put together, and teaching them how to SOAP note, so they're stating instead of opinion, and oh, the person seemed to be agitated or depressed, and that's their opinion. They would need to be able to say the patient stated they were depressed. It's not, there can't be any opinion from a non-medical person. And it's interesting that you say that. When I've gone into centers to help them with accreditation, there was a lot of opinions from patient advocates, peer counselors, whatever their titles are, and they really need to learn how to document, because again, that medical record is a legal document, and everything in that is discoverable. Mm-hmm. So if you're having a non-medical person saying person was depressed, you know, all those types of things, that is not, I mean, that person doesn't have that credential to be able to determine that. So the only thing that could be put in that record is patient stated they were depressed. Patient stated that they were, you know, having nausea. Patient stated that, you know, they were having trouble sleeping. And then it's the patient advocate, peer counselor's responsibility to look at that and say, well, I need to have our healthcare professional address those issues. I cannot address those issues.
Mm-hmm. And that's where I think the temptation could fall, where a non-medical client advocate who's collecting medical information from a patient could easily cross over into even giving the perception to that patient that they're distributing medical information.
Right.
Be very, very careful about that. You are a medical facility. Non-medical people should never, ever, ever be giving out medical advice. And,
right.
And and like you, this is really funny, because then I'll get pushback from the client advocate saying, well, can I just tell them my own personal experience about pregnancy, or my own personal experience about the abortion and what the procedure was like and what I experienced? Could you respond to that, Lorraine?
They can tell them their personal opinion, but it's interesting that you're bringing this up, because I was at a center that just had their survey, and one of their lead patient advocate people, you know, we had a long conversation about this, because, you know, they would say, well, you know, the person said that they were having trouble sleeping. So I told them, well, they need to do this and this, you know, because, you know, that's how what I experienced. Or they were having trouble with nausea, and so, you know, I said, well, you need to, you know, take ginger or stuff like that. And I was going, no, no, and no. Mm-hmm. Because then there's that perception that that person is credentialed to give out medical advice, and that person is not credentialed to do that. Now, you can give out literature and say, you know what, I'm going to have the healthcare professional talk to you about these things, but here's some literature that's been approved by our medical director. That's fine. But giving out information, sharing your experience is fine too if you're wanting to do that. But just know that everything that you're talking to them about needs to be documented in that record. And that record is a legal document.
Mm-hmm. Okay, we got a little sidetracked, but I think that's really important as part of this risk management, the fact that you're a medical clinic. Now, shifting gears a little bit, Lorraine, here we're back to a high-tech act question. It says here, okay, what in the high-tech act makes a PRC now a covered entity under HIPAA? Have they expanded the covered transactions?
Actually, the Office of Civil Rights is modifying what a covered entity is at this moment, and I'm waiting for a phone call to get a definitive answer. Right now, a covered entity is someone that transmits electronic health information. And so my question to them was, okay, so what about the people that, you know, do STD, they have a paper chart, but they do STD testing and they get the results on the computer from the CDD or from the lab. Is that, I mean, that's electronic. That's an electronic transmission that you are receiving. So those are the questions that I am waiting for answers on from the Office of Civil Rights.
Okay. Here's a question. We will not always have access to email. One of the things new clients do is text us. Are you saying we can't communicate with them? And I think what I heard you say, Lorraine, is you still have to use the principle of the computer. You can use, if you have a smartphone, and you can go to the internet and use your emailing, the Google emailing system to do that, yes. But still the standard is you just don't want to text, correct?
Correct.
Okay. Is it okay that non-medical people ask when the first day of your last period was?
No.
Why?
Well, for me, I would just have them fill it out themselves.
Mm-hmm.
Why does a non-medical person have to ask that?
Well, you
Because
know,
what if,
well, I was going to say a lot of the receptionists ask that. I'm very surprised that that's still a standard that's out there, where the receptionists are taught to ask a client on the phone before they're a patient when their last menstrual period was.
So here's the thing. What if that person says, well, I'm really not sure, I normally have a 4-day flow, but, this time I only had a 2-day flow. Would you consider that a full period? How are they going to answer that?
Mm-hmm. Yeah, and now you've crossed over into medical, right?
Right.
Yeah. So easy to have happen.
I know it is.
So easy. That's why these guidelines are so important. All right, I'm scanning.
I know it's hard on the pregnancy centers because they've been so used to kind of having a really gray line to all of this. But that gray line, I was asked a question yesterday on a conference call I had, I was asked, do you know of any pregnancy centers that have been fined for non-HIPAA compliance? And I said, no, I don't. But that doesn't mean that it can't happen. I mean, case in point is, that Hospice of Idaho is a nonprofit. They never thought they would be fined, and they got fined $50,000. Mm-hmm. So to me, the risk is far greater than the time it will take to put this in place.
Mm-hmm.
If one of the pregnancy centers is fined $50,000, $100,000, that could potentially close their doors.
Mm-hmm. Mm-hmm. Okay, here's a question about on these important forms and consent forms. Can you use an abbreviation for your center name, such as PCC?
Yeah.
But I would say only if it is spelled out somewhere at the beginning, right? So that there's clarity on what that is.
You would say like Pregnancy Alternative Center, and then in parentheses, PAC. That's what I would put.
Yeah, and then they could use PAC all the rest of the way in referencing on that. Yeah, that's really important. That's the standard of form development in risk
even
management.
on the business associate agreement, when I've done them for the centers, I've always put their full name first, parentheses with, initials, and then throughout the rest of the document, just initials.
Mm-hmm. Okay. Should we not fax information to OBGYN doctors requesting information regarding our clients, even if the client has signed a release information form?
So here's a new thing for the pregnancy centers, that if you're having your patient sign a notice of privacy practices acknowledgement, and in your notice of privacy practices it says that you will release information based on treatment, payment, or healthcare operations, that falls under treatment. So if you saw a patient, they had an ultrasound, you got a request from their physician to send their information, you would send that information either via fax or scanned and emailed, however way you use it, but you would, yes, you are obligated to do that.
Mm-hmm. So would that replace the need for a release of medical records if they're utilizing that? No.
If they haven't signed a notice of privacy practices, then yes, they would have to sign the medical authorization to release medical records. But if they have signed it, then no, it's considered treatment.
Okay.
Oh,
I see what you're saying. There's a difference between a request for information for treatment purposes versus a request for information, period.
Period, right.
Oh.
So if you have someone sign a Notice of Privacy Practices acknowledgement, basically you can release information to physicians that are requesting it without another authorization. If the patient comes in and says, I want a copy of my medical records, you would pull the medical record, you would see if they've signed a Notice of Privacy Practices. You would not have to have them sign another release. And also for healthcare operations. So if you're doing STD testing and they have a positive STD that needs to be reported to the health department, then you don't need to get an authorization, and you wouldn't have to in that place anyway because state law says that you don't have to have an authorization to do so.
Okay, now here's a question that's connected to that. She says here, we've had several physicians ask information without an authorization signed by the patient and are offended if we don't disclose it if we saw the patient, how far along, etc. They say because of physician-to-physician policy, we should be able to do this. Are they correct?
Only if the patient has signed a Notice of Privacy Practices acknowledgement or they've signed a release, either one.
Okay.
So the first thing you would do is pull the chart or get onto the computer electronically, see if they've signed a Notice of Privacy Practices. If they have, then yes, you can disclose that information, and those doctors are right. If, as long as if they have signed those, then you are obligated to give that information.
Mm-hmm. Can the email address used for text messaging be used through a cell phone?
Yeah. Yeah, if you have a smartphone, like I was saying,
Mm-hmm.
I can get onto my email
Mm-hmm.
via my smartphone, and if I'm traveling, I can answer emails through my phone, but it's going through my email.
And
Does that
not
make
through
sense?
text messaging.
Exactly.
Yeah, that's the big difference.
Yeah.
We do patient follow-up by email. Should this be copied and placed in the file?
Yes. Absolutely, yes.
Okay. How do you
And
do?
it needs
I'm
signed.
sorry. Go ahead.
It needs to be signed. So when you print it, whoever authored that follow-up, if the nurse, Leslie, called the patient to follow up and she did her documentation, she would, need to sign, first initial, last name, and RN, or, and then, because that is, saying that she did that, and then it goes in the file. She's authenticating it.
Mm-hmm. Okay. Could you summarize again, Lorraine, a question here about how do you email to a phone text?
So you set up the email account, and then you have addresses that we have supplied to you for each service provider. So an example, I have Verizon. So you're emailing me, and so you would put in my telephone number, with 509-723-7497 at, and then I think Verizon is vxt.com. And so then you're doing it in an email format, it comes to me in a text format.
And you have all of those documents, but I can see where if they don't have it in front of them as we're explaining this, it's a little confusing. So
yeah, you downloaded all the documents, and one of them is a list of every service provider. I think there was quite a few of them. Mm-hmm. And so on the consent form, they have to list who their service provider is. Mm-hmm. And so when you're emailing them in the the address to, you would put their phone number at, and then the service provider, AT&T.com or whatever that is. And then is email to you, text to me.
Okay. Can you just put a quote, "Do not reply," at the end of the text so you don't run into any of these problems?
Yes, you can. And you can also, oh, I just lost my train of thought. Thinking about texting. Yes, you can put "do not reply."
Okay. Does that eliminate the need to be doing these other things?
I don't know.
Oh, I'm sorry. Yeah, like they still need to communicate the text messages from computer to cell phone.
Yes, or cell phone using email. You know, yeah.
Okay.
You always need to go through an email account is what I should say, whether it be on your computer, your iPad, your notebook, your cell phone. That communication needs to start from you as an email communication.
Okay. Lorraine, the question has come up about where you've mentioned that there's this pressure, a requirement to be compliant by 9/23 of this year. Someone would like to have you explain a little bit more about what that means.
Well, because the HITECH Act went into full compliance January 17th, everyone needs to be compliant by September 23rd, and what that means is they're giving people time to be able to get their business associate agreements developed and given out to all of their vendors, which would include, again, eKairos, WayCool. It would also include your, if you get maintenance on your printers, I don't know if you're aware of this, but anything that you copy, that is stored onto a hard drive onto your printer. And so when you have someone come and service that printer, they have access to any of that. So you would need to have them sign a business associate agreement. When you have your ultrasound machine maintenance every year and you want the hard drive cleaned, and I'll give you an example. I was at a center that they had their ultrasound person there, and we had them sign a business associate agreement because what he told me was that, I go to a lot of centers and they ask me to, kind of delete a lot of things from their hard drive. He said, but I can't do that because I don't have a business associate agreement signed, and they don't even have a business associate agreement because I'm looking at protected health information. And so you would need to have that person sign a business associate agreement. If you have an IT person that's a volunteer, you would need to have them sign a business associate agreement. Those are and that's all listed in the HIPAA training.
Okay, another question for clarification. When a patient who has not been seen at our clinic, can we text her a reminder that says, quote, "You have an appointment at PMC at 2 p.m., unquote"?
Yes.
Can they do that with or without verbal or written consent?
Well, they need to get verbal.
Okay,
so when that person makes the appointment and the receptionist says, how would you like us to communicate your reminder? And they say, I want you to text message, she would put that in the notes in that appointment scheduler, or if you're, whatever system you're using.
Can a peer counselor that is also a registered nurse give out medical advice?
Yes, as long as they've been approved by the medical director to do so.
Okay. Can a non-medical receptionist tell potential clients when they are planning on coming in for an appointment that they're supposed to have a full bladder?
Yeah, they can do that.
Okay. Our center has a requirement for 7 weeks LPM to come in for an ultrasound. What would you suggest we do to get this requirement filled without asking an LMP?
Oh, I see what you're saying. So they're calling to schedule, and you're needing to determine whether or not they're eligible.
Correct.
Well, wouldn't you want them to come in for a pregnancy test? I mean, wouldn't you need to do that anyway to confirm it? I mean, you're just taking their word for it. So wouldn't you need for them to come in and do a pregnancy test to confirm that that's, you know, that they're actually pregnant, and then go from there?
Well, yes.
Right.
But
So
I do hear this often, that they do a lot of screening with the LMP questions with the receptionist even prior to setting appointments.
Well, it would be my suggestion that, I mean, obviously you're going to do another pregnancy test to confirm that, because someone may not have had their, you know, period, but they're not pregnant. And so I would just have the receptionist have them come in and have that pregnancy test, and then have the healthcare professional determine that.
Mm-hmm. Okay. All right.
You know, it's not the receptionist's job or responsibility to determine whether they're eligible for an ultrasound. That's a medical professional's job and responsibility.
I absolutely agree with that. And again, I think the confusion has been where the medical clinics are still having one foot into the Pregnancy Resource Center mentality, and even some of the affiliates are encouraging this or not creating the distinctives. So again,
Right.
We are coming from the assumption and the core value that you're a medical clinic, you're a doctor's office, and therefore need to act like one. So
Right.
again, that's where we're coming from. All right, we're circling back again to this little hot question, and it's a landmine, I know, but the question here is, we are medical, but do not have nursing staff here every hour that we are open. Are you saying that our advocates should not be doing abortion education, STI education, etc.? We use a self-test model when a nurse is not here.
And my battery's going dead on my phone. Okay, so you should not be doing, well, okay, my opinion is you should not be doing self-testing. What I would suggest you do is you have a couple of your patient advocates be trained, documented, demonstrated and documented that they can do pregnancy tests, and get that approved by your medical director. As far as education on abortion and STDs, they can do handout information, but it would be, and so we go back to, if they are positive, then it's the responsibility of the nurse to contact that patient and say, you were in, you had a test for a positive test, they come back in, and then the nurse would go over more of that information with them, and they would determine whether they're eligible for an ultrasound. So, you know, I particularly don't like the idea of doing self-testing. I would assume that you would just give them a self-test. That's my personal opinion. As far as patient advocates doing education, the slippery slope here is the questions that are asked and how are they responding to the answers. So it's fine to be able to give out handouts, show videos, have people look at all that information, but then what happens when that person asks a question? What if that person asks a medical question, which those are two medical topics? How are those answered? That would be where it would be a very slippery slope. Does that make sense?
It does, yeah. Yes, that does. Okay, how's your cell phone doing?
Well, I'm not on my cell phone. I'm on my regular, and the battery's going.
Oh, the battery on your regular phone, okay. Oh, goodness. Okay, real quickly, there's just a few more questions. Oh, my gosh, a whole bunch more just came in. But I'm trying to scan for the most important ones that haven't been asked yet. Here's one. Will MPRCs have to eventually have EMR and not paper charts?
If you're not billing insurance, you'll never have to worry about it. Because the only reason why they're making medical practices go to electronic or forcing them to go to electronic by 2014 is because they're billing electronically. And so the penalty they're going to be holding over the medical practices is that we're going to hold back 5% of your reimbursement from Medicare and Medicaid. And so in reality, if the pregnancy centers are not billing insurance, they will never have to be electronic.
Okay. All right. Is it okay to have the client sign a statement on the intake form that says they approve and understand that the Notice of Privacy Practices instead of signing the Notice of Privacy Practices form?
There's the Notice of Privacy Practices is a separate document than the acknowledgement. The acknowledgement is saying, I read, understand that my information, we have a copy that they'll have access to, that I understand and I am allowing, them to disclose my information in that manner. Did I answer the question?
I think so.
Good.
Another question, does the release of information to physicians also apply to agencies such as HHS? In other words, if a client's case manager calls to verify her medical information or a Medicaid application, is it okay to release that information by phone if the client has signed the HIPAA form or a release form?
Yes, because it's under healthcare operations.
Okay. Please clarify, do we need to ask for their service provider, or is it our service provider? Oh.
It's their service provider, and they will document it on the consent form.
Mm-hmm. Okay. Where can I find the HIPAA training that you are referring to? Again, y'all, I will send that to you, a link. I'm going to send you an email this afternoon. That email will include a link to this where you can watch the video. I actually sent one out yesterday, so you can check and see the one that I sent out yesterday, but I'll be resending today. In the HIPAA training, a confidentiality non-disclosure statement for volunteer staff and the board of directors was mentioned. Is that form available?
Yeah, I mean, I don't think it's in part of the HIPAA thing, but I definitely can make a note of it and send it to you, Beth, and then you can have them upload it.
Okay. Sometimes clients come here with a proof of pregnancy from another facility. Do we still retest?
I would. Definitely I would. That's up to you, though, and that's up to your medical director. But if I was running the practice, I would.
Mm-hmm. Here's a
That's
question.
going to be part of your medical director's standing orders, whether he wants that, he or she wants that or not.
Okay. What if they're doing self-administered tests, which I know you're not thrilled about? How do we determine if they are eligible for an ultrasound?
You don't. The nurse will have to do that assessment.
Yeah. Yeah, that's yes. And NIFLA is very firm on that as well, that if you're doing self-testing before they have the ultrasound, they need to come back and it needs to be retested by a nurse or a qualifying staff that's been approved by the medical director.
Right.
Okay, knowing the LMP helps to determine how much. Oh, yes? Yes.
I'm calling in on my cell phone because I don't want to end up losing this phone.
All right, go ahead.
Hold on.
All right. We still have a pretty large group here, so we're getting real close to the end.
No, it's fine.
Okay.
Hold on just a second.
All right, everybody. Let me see if I can.
A second.
We have a limited number of sonogram appointments and need the LMP in order to determine the correct appointment. The doctor's office does the same when making an OB/GYN appointment. Okay, here's the difference though, is that you don't have a doctor on site. And so sometimes because the doctor's office does something a certain way, doesn't mean that you should be doing it that way. Uh-oh. Uh-oh, okay, had some feedback there. You okay?
I'm here. I'm on my cell phone now.
Okay. All right, so I started to answer this question, but I'm glad you're here. It says here that knowing the LMP helps to determine how much time is needed to schedule for that particular appointment. Abortion intent, home test is, oh, I'm sorry, I combined two. So they're saying here is if they need to have the LMP because that helps to determine how much time is needed to schedule for that particular client-patient appointment.
Mm-hmm. So, okay, and I understand what they're saying. So if you have to be able to do that, then the receptionist can just say, when was your last period? If the person says, well, I don't know, is this considered, I normally have a 4-day flow, but then I only had 2 days, is that considered a full period? At that point is when the receptionist says, you know what, I can't answer that question. I need to put you on hold and find a healthcare professional, period.
Mm-hmm. Okay. Well, we're at the end here. We just have a couple more questions, and you're muffled, Lorraine, so we can't understand your answer very well. So,
is that better?
That is better. Yes, it is.
Oh, I took you off speaker.
Oh, okay.
Okay.
2 more questions, and then we're done. It says here, I'm not seeing how a non-medical client advocate is of any use if they can't ask LMP.
So again, if that's something that has to be done to have clear operations in your center, that's fine. But there needs to be a standard in place that, yes, okay, what was your last LMP? They give you the date. Which that's fine, but what if they say, well, I don't know because, I had my full periods are normally 4 days, but I had a 2-day period, it was light. Would you consider that a full, would you consider that how could a non-medical person answer that? Mm-hmm. They can't answer that. So they would have to defer to the nurse. And so either that person would be put on hold, you would get their phone number and have the nurse call them back. However, whatever that looked like, but a non-medical person is not qualified, nor are they credentialed to be able to determine whether that was a full period or not. Mm-hmm. So if it's clear cut and they say, yep, my last period was, September 15th, fine, you can put September 15th. But if there's any question, and I've seen where there are questions about it, they cannot make a determination because they are not a medical professional.
Mm-hmm. Okay, I think that's, again, I think we're butting up against this old way of thinking, like kind of like a pregnancy resource center. And I would also say that if you move to a linear client platform, you'll find that the client advocate's role is so important, but it becomes a little bit different. It's more defined, and actually this non-medical person walking along patients who are in the process of making a medical decision is becoming quite a popular component of a lot of the medical clinics all across the United States. They call them patient coordinators. But we're not going to get into that now because we're the end of the process.
Well,
but,
and that's where the team comes in.
Yes.
To best serve your patient psychosocially, all resource-wise. You need to have your patient advocate, whatever client advocate, and your healthcare professional working together to serve that patient.
Mm-hmm.
And then there's clear lines of authority on either side.
Mm-hmm. Okay, well, it's almost 12 o'clock, well, 12 o'clock Pacific Standard Time or daylight time, and so I think we don't have any more questions at this time. Thank you, everyone. Most everyone has stayed for 2 hours. So I hope you've all found this very beneficial. And again, I will be sending you all the information that this afternoon, a link where you can view the recorded version of this broadcast, a link also where we'd really appreciate it if you would go to this link for some feedback. And so I'm going to call this webinar broadcast to a close. And thank you, everyone, for joining us. And God bless.
Thank you. Thank you.